this is the time that I went and joined the IEHP program in the University of Toronto. This was the first bold decision that I made, and I never regretted afterwards. This was really important because it is super expensive program. In my time, it wasn't mandatory. I know now it is mandatory in Ontario and other provinces. You have to take it if you didn't pass it the first time. In my time, it was optional. And it was almost every penny I have to pay for it. I forgot the number, 10,000, 15,000. Super, super expensive. But it was the best decision I have ever made. It's like a gambler who put all of their money on the table, and I think that paid off. So that's my advice, which is, so now when I attended IPG, it was super duper difficult program. It is a very robust program. And I was a working pharmacy technician at the same time. So I took 8 to 4 in the school, 5 to 9 in the pharmacy. That includes Saturdays and Sundays. So I was working 25 hours a week in addition to this program. This is super difficult. But working with those people and having instructors know my skills, know my ability, that helped me in my next step, which I went to take my Canadian board examination, like I have my PVC and everything else. Now, Muhammad was talking about the alternative pathways. I did that at the time. I applied to the States, the licensing in the States. I found that, well, why not do both? Since you are applying to one, what's good for the goose, it's good for. So I applied and I took both of them. And I never set a foot in the States, but I still have my Michigan license active until now. When I finished my IPG program, at our time, and this is exactly what Dwight was talking about, expand your horizons. So I applied to Aurelia Soldiers Memorial Hospital. They had a position there for an intern in hospital pharmacy, and then that led to a full-time pharmacist. It is about an hour and a half north of Toronto. For me as a new immigrant, it is super difficult to stay there with virtually no immigrant. So I have to be there on my own. Then I have my wife came afterward. So it was not an easy move, but I think I never regretted this move because it exposed me to the hospital practice. I worked with fantastic people, and I learned a lot when I moved to Oregon. So again, number 2 is have the flexibility, the open mind to move to other places where it gets the opportunities. This opportunity here opened a lot of experience for me. Pharmacy practice in hospital. I don't know if some of you might be practicing in hospitals. It gave me the excellent exposure to patient care. I had training in anticoagulation medication and so on and so forth. But on the side here, IPG participation in hospital practice is still suboptimal, and I'm going to show you some research that I have done there. But please keep in mind that this is one of the best practice settings that you can apply to, but it is not easy to get there as well, not to mention after you get the license. After that, I went to Saskatchewan. That was my third bold move. Don't know where Saskatchewan is. It is in the middle of nowhere. And people warned me not to go there. They said it's like the Louisiana of Canada. Do not go there. No immigrants go there. I did not really listen to that. I went there, and I can say I consider Saskatchewan my second home. 2 month kids were born there. Love the people. It might be a cold place, but very warm people. I love the place. By the way I got my job in the hospital, the manager there called my instructors in the IPG. So I got that recommendation from my instructors in the IPG in front. When I went to Saskatchewan, I emailed the supervisor there, Dr. Blackburn, who I owe everything to him. So he asked for references. I gave him the names of the 7 pharmacists in my department in Oregon. Guess what? He called each individual, each one of them, because for him, somebody with a name that he cannot really read from a country, great. The master is all history, but come on. And nowadays, what kind of education did this guy get? So he called every individual on that list called 7 or 9 people on that list to get that this is really a good student. So he accepted me in masters. Then I transferred to PhD until I have done my grad school in Saskatchewan in 2014. Then I moved in 2015 to Waterloo, where I started my faculty appointment as an assistant professor, then going to associate professor in 2023, where I teach in the undergrad. I teach second year and third year. And I work with pharmacotherapy, I work with pharmacy skills, and so on and so forth. And also I do research on pharmacy practice and pharmacoepidemiology. So this is just a general idea about my research program. As you can see, at the heart of it is the socioeconomic studies. So I'm very much interested in the vulnerable populations, the disadvantaged populations. You remember that guy who was talking with the cashier? You'll see that in the pharmacy, especially if you are dealing with a population that might be refugees, where they have limited language. Aboriginal, that they have distrust in the authority. Low-income Canadians, lower educated Canadians that also have distrust of the system. Those low socioeconomic status, this is the heart of my research. It can go from pharmacopediology, focus on the opioids, as well as in pharmacy practice, expanded pharmacy practice, immunization. Also, I have a program going around vaccination that can be both pharmacopediology as well as pharmacy practice.
Hello.
The general here is I look at administrative databases, so big data, to try to get conclusions about those issues, but I focus on SES specifically, which I'm going to present some of the information later on about the IPG. So that's about myself. I know that I was bragging a lot here, but my message here is be bold in terms of steps. And every step, it might have a lot of precautions, but it will be really paying off on the long run. So moving on, and I'm sure that you have seen those multiple times. The licensing pathway when you want to be a pharmacist in Canada. Those are the resources that I bet you have visited a million times now, but this is the good start, always the first one, the International Health Professionals Association and the Pharmacy Gateway, in addition to the PEC, and in Ontario, the OCP website. So this is directly from the website. And again, I'm sure that you have seen this multiple times. You start with the registration on the website, documents evaluation, evaluating exam, qualifying 1 and 2, and then the internship or experiential experience, and then the jurisprudence exam, and paying the fee and getting licensed in the province of your choice. So before I go into details, do I have to go through any details about any one of those steps that you feel that there is a need for some information about? I'll probably also open the door for my online folks. And feel free to share your own experience if there is something unclear here or whatever the case is.
I'm eventually position at a time working in a French organization. But I have a question, please. You mentioned that you have got your license, but after this you had a PhD, and after you are a professor. So to be a professor, I know it isn't required to have a license to practice. Those who are a professor teaching and making research. So my question is, the license, does it help you?
Thank you for that question. So repeat the question for our people online. So I did my license as a pharmacist in Ontario and Saskatchewan. The question is, do you really need it if you want to be an academic, a faculty member? The answer is, for the most part, you do not, unless your project requires a practice component, which in my case it was. So in my master's degree, I did a pharmacist intervention randomized controlled trial, where I went to patients, I provided pharmaceutical care, which is a restricted activity only for licensed pharmacists. For the most part, even if you want to work in pharmacy practice research, you do data analysis, you do therapies, you do something like this, you don't need a license. Not to mention, if you go into pharmaceutical sciences, you do DNA work, chemical work, something like that, you don't need a license. But in my case, because my project contained a work with patients, so I provided care to patients in my study that needed that as well. Now, that helped me also on the other side when I applied for my job. There isn't a lot of people who are both licensed pharmacists and PhD graduates. So they gave me the job because I could teach in the undergrad program. So I teach pharmacotherapy, I teach skills, like professional skills, as well as I do research on my databases and so on. So that gave me advantage for employability as a licensed pharmacist and as a researcher. Now, keeping that license active is not easy. I know that they changed the rule recently. You have to have at least 200, what was the number, the 2,000 hours a year. So I had to take 4 hours every week for the whole year until I get my license active. I think now they changed the rules in OCD, but it wasn't easy when I was a faculty member and I was working in clinic in my area. So I hope that answers the question. You don't have to have the license, but it is helpful as well. Perfect. So since everyone seems to be clear on that process, I'll probably just go through it very fast. So if you haven't done this already, you have to submit your documents to the PEDC. There is a process, there is a fee. They have to make sure that this is a good pharmacy school and so on and so forth. Once this is done, you are going to write the evaluating examination. Again, I don't know that last time I checked it is 140 questions, about 3 hours. I don't know if it was the same in your case, about 3 hours, 3 hours and a half exam. It is very pharmaceutical sciences, still have some pharmacotherapy. They give the breakdown on the website. The good thing is, unlike my time when we had to do it only twice a year, now there are a lot of exam centers where you can do it online, super easy in terms of scheduling and everything else. So, again, this is my own experience. So this is the book that I studied at my time. I don't know if it is still, probably they have something different now. So in my time, it was Comprehensive Pharmacy Review. This one is a super concise. So when you need something that you don't really remember, you have to go to other books. For example, in my time, I studied pharmacology. If I don't remember a specific aspect of pharmacology, I would go to this book. Then I understand that sentence that put there. If I don't remember something in biochemistry, I will go to the textbook to remember and so on and so forth. You probably have something now totally different. Anyways, the idea here is to look at, and this one is for pharmaceutics, you have to look at the super concise content, and if you don't remember something, you have to go to the more expanded knowledge, review it, and then you will be able to take the exam well prepared. After you are done with that, you have to take the IPG again. This became mandatory in Ontario unless you pass your qualifying on the first try. In my time, it was optional, and I cannot tell you how much I really thank God for that decision that I took, that I had to go with the IPG. It opened all the doors for me. It is super intense program, but it has so much benefits. After that, we are going to take the qualifying examination. This examination is for all firms, including our own graduates. So we prepare our graduates for the qualifying examination. There are the two parts. There is MCQ, that's part one. That is knowledge-based. Basically, you have to take the questions. It is mainly pharmacotherapeutics. And again, the last time I checked was 4 hours, and it was still the same thing. On my time, it was 2 sessions. Now it is 1 session only. And there are about 200 questions. They have some of them trial. but basically you are going to be tested on the knowledge itself. It's multiple choice question. The part two, that is more of a skill test, that's the OSCE. When I came in 2004, it was very fresh. They started, I think, 2001, 2002. So, like me, I was from the early people who had to take the OSCE. Now it's becoming more and more standardized and more established. So this is 12 rotations, they call it rotations, they call it stations, 12 stations, and you have to go through them. We train our students on this, and hence, if you take the IPG, you'll be very well trained, as opposed if your program did not really provide this. After that, after you pass your exam, both qualifying 1 and 2, you will be able to do your SPEC, that's a structural practical training. Now, if you took the IPG, usually they let you start the training before you pass your qualifying examination. And usually they are up to 32 weeks, and they are managed by the college, where you go to your practice training. It's not only being in the practice setting, you are going to do cases, you are going to do assessments, you are going to do identify DTPs and so on. You have a practice advisor at the college to help you through the process, and very rigid process, very robust process until you develop the skill that is required for the licensing. Last but not least is the jurisprudence. You just take an exam for that province on law exam. Again, I'm talking here Ontario. The same for other provinces. When I took my Saskatchewan exam, it was verbal and written, so you have to speak with somebody or some advisors from the college to give you your license. How much does it take? About 1.5 to 3 years. In my case, it took me 2 years to get my license. How much does it cost? Depending if you are taking the IPG, which I highly recommend. A lot of money. Not to mention, as Muhammad said, if you have a family to support, that's a lot of money, man. But still, it is rewarding at the very end. And those are the other exam fees that you have to pay for the evaluating, for the qualifying, and so on and so forth. It is a lengthy process, lengthy journey. They allow you only 3 times. If you did not pass on the 3 times, they allow you a 4th and final attempt, but you have to give them some proof that you have done something else. You have taken a program or a training or something like this. So there is not endless, that's a double negative. There is a limit of how many times you can apply and take those programs. So, key challenges, we are living this. You guys are living this, and I live this. Adaptation to a new culture. The course that you have to go through this. Not only the language, the communication. And by the way, in the IPG, they had a communication skills course. So you have somebody to teach you about non-verbal and verbal communication, about assertive versus negative communication, and so on and so forth. So communication skills is extremely important in this process. And complex regulatory systems and licensing requirements. Things change so fast until your head is full of a lot of information, so you have to take it one step at a time. And I can say that the help I got from my IPG, who came before me, who gave me some advice, not always good advice. You have to be very critical about the advice that you get, but listen at other people's experiences and try to filter it down, validate it with the external resources to make sure that you are taking the right path. Last but not least is managing the financial burden. Again, I remember when I was in the IPG program, I have to leave home at 7. I have 1 hour subway travel to get to my IPG program, and then I have to work in the evening in the pharmacy. So from 7 in the morning until 10 every day, 6 days a week. It wasn't really that easy. Now, when I was taking my grad school in Saskatchewan, I was licensed pharmacist, so I can work in the hospital pharmacy, so I can support myself. Again, a grad student's salary is not that much, so I had to work as a pharmacist. that helped me through my grad school years. So, back to my talk about what we know about international pharmacy graduates and working in a hospital. Things are not super good. So this is the first paper that we published, I think last year or the year before, where we looked at people's graduation country and where they end up in terms of practice. So we published this in the Canadian Journal of Hospital Pharmacists. And what we did was we looked at the Ontario College of Pharmacists website. We extracted all the data about all pharmacists, where they graduated from, and all of their reported place of practice. Every pharmacist in Ontario, they have to say to the college where I practice. So we took those places of practice and we divided them to be a community pharmacy or a hospital pharmacy. And then we matched them to see what is the chance if you are an IPG to work in a hospital as opposed to a domestic practitioner or domestic graduate, and what is the odds of being in a hospital practice. And here is the result. So we end up with about 5,028 pharmacy practice sites. That includes both hospital and community. And we end up with about 14,000 pharmacy practitioners, or about 15,000. Those are the pharmacists that we. What is the percentage of IPG? Anybody? From all pharmacists in Ontario? 50 actually. 50% are IPGs. That's the reality. We are there, like half of the workforce in Ontario is IPG. Now, the other 50% are Canadian graduates, okay? Now, if you look at the states and you consider them as with the domestic, the number will come now about 55, I forgot the exact number, about 55 or 60. So the American graduates, you can consider them as a North American graduates. Anyways, using the IPG definition as outside of Canada, about 50-50, okay? So, from everybody else, let's look at all. First, at the top line. So, in all pharmacists that we have in the sample, about 20% reported working in a hospital versus 80% in community. Make sense? That's what you'd expect. You have a lot of people working in community. But when you divide people, remember those are 50-50%. If you are an IPG, your chance is about 5.8% work in a hospital, versus if you are a Canadian graduate, domestic graduate, about 33%. So looking at those two numbers, this is how we end up with 20%. So there is a clear underrepresentation of IPGs in the hospital practice. When we try to convert it into number, what we call odds ratio, what is the odds of being practicing in a hospital if you are Canadian graduate, you can see that it is almost 8 times, 7.98, after adjusting for age and the other covariates. We found about 7 times the odds of working in a hospital if you are Canadian graduates. When we added North American graduates, like US, to the Canadian graduates, to be one part called it North American, this odds ratio became almost 11 times. So 11.45, 10.32. Meaning if you are a North American graduate, your odds of being practicing in a hospital is almost 10 times as opposed to your fellow IPG who's coming here. So there is a clear streamlining process that is happening. If you are an IPG, you go to community. If you are a Canadian graduate, you are more able to get into hospital practice. By the way, this is not only pharmacy practice. This was seen in IMGs. This was seen in INGs, also the nurses, in terms of more clinically oriented practice settings. This is mirroring what we are seeing in other international health professionals. So we went to the next step, and that's why this is happening. So practicing in a hospital, it requires you usually, not necessarily. In my case, I did not have to have a residency. I went there, I trained, I became a hospital pharmacist. But usually, in order for you to get your foot in the door for being a hospital pharmacist, you have to have a residency. So we started by looking at the data from all residency programs. This is administered by the Canadian Society for Hospital Pharmacists, CSHP. It's called the Canadian Pharmacy Residency Board. They list all the programs that they accept residency applicants on their website. So we went through them and we looked at the eligibility criteria to see if there is any encouragement or discouragement of IPG to apply to those programs. This paper is still under review in the journal, so it's not published yet, but I'll show you a little bit of the results of this paper. The other thing is, we looked at the residency data from the board to see who applied to the residency and who was successful in matching to a residency program. So we asked the board, thankfully they gave us, and we're very grateful to them, they gave us the data and we analyzed it to see who applied, what is the proportion of IPGs, and who was successful, and what is the proportion, what is the odds ratio, depending if you're IPG or you are a Canadian graduate. Here are the results. From all the programs that we looked at in terms of eligibility criteria, about 15% they said you have to be a Canadian or American graduate. We're not going to accept your application if you're not. So that we are left with the 85% the remaining programs. About 7.5% they said graduating from quote-unquote recognized institution without explaining what is quote-unquote recognized really mean. Which might be confusing. Do you mean that an IEHP, am I eligible to apply or not? Doesn't really say. Some programs actually they say in undergraduate training in pharmaceutical care. Again, not every university has this. Again, does it apply to me as an IPG or not? Two programs actually they said completion 600 hours internship outside province for people who came from outside the province. Again, does every pharmacy program provide this? Are you going to recognize my out of country? It is not clear on the website itself. Some of them said international, actually this one was very explicit in saying international and out of province applicants are welcome and encouraged to apply. So they were saying, yes, come on in, but not common. About only one or two programs that they were, yes, IPGs can apply to us. Another issue we found was about half of the programs, or sorry, one quarter, about, what was it, 25? It is 65, sorry. 65% of the programs, they said, we need a cover letter that comes with your application. Now, I know that you went through the cover letter when you applied your first job. You have to write a really nice cover letter that tells the employer that you know about their company, you know about their culture, and so on. But here you are talking about hospital practice. In order for you to write the right cover letter, you have to know how pharmacy practice in hospital happens. So for you to be able to write an effective cover letter, you need an inside perspective to be able to write the letter that people or employers are looking for, or in this case, the residency coordinators are looking for. So we identified this as one of the hurdles and one of the challenges, because for me as an outsider, writing a cover letter that doesn't really touch on the points that the coordinator is looking for, that will shut me down out of the bat just before starting. Now, when you look at the data itself, we found that in that year, that was the cycle, I think 2023 cycle of the residency. 312 applicants applied. From them, 7% only, 7.7% were IPG. Remember, what is the proportion of IPGs? In Canada, about 30%. In Ontario, about 50%. So this one is national. So this one is all over the country. Applicants, 7.7%. Versus Canadian graduates, that's domestic graduates, about 92%. So they are not getting to the application process, the application phase to start. Okay, among those who applied, what is the odds of matching or being successful? The answer is, you can see on the top here, IPG yes versus no. Your chance of being successful is 0.4, meaning you have 60% less odds of being successful. That is problematic as well. So not only you're not applying, even if you apply, your chance of being successful is not that much high. Remember the example I told about the gap, about 70–80%? You have to do something about correcting and verifying this process. So we go to the third project. This one, we did not send it to publication yet. So what we did is we got the database about all pharmacists in Ontario, and we invited IPGs in Ontario to give us their perspective. So we had a response rate, we ended up with 317 people who took our survey, and we asked them, what do you guys think? I don't have time to present all the data here that we came up with, but those are the two highlights that I want you to take note of. Number one is, a lot of folks have a bachelor and, pharmacy in addition to residency. So they came with a residency from their home bachelor, and that was about 5%. Remember that they came in with a residency, but they did not end up working in the hospital. Now, in this sample, we have about 20% that were in fact working in hospitals. So we have really good representation. Nevertheless, now, this is on us. The residency question that we asked was about having a residency training in hospital or industrial. So it wasn't really super specific to hospital practice, but still it tells you that there is a residency. When we asked them, did you have any Canadian convictions? So did you take any school in Canada after you immigrated? This is an answer, and as you can see, a lot of folks are taking the IPG program, which is fantastic, that's great, but still it is not opening the door for the hospital practice, this is what we are caring about. Not only this, 3 people actually from our sample, we have 300 people, 3 people actually took the residency program in Canada. They were successful, and 2 of them actually ended up working in a hospital. So that means still it's possibility. We just have to open the door. So the next step that I'm working on, which is working with the IPG program here in Toronto, to try to connect IPGs with the opportunities for internship in hospitals, like placements, like training, like internship opportunities, that is probably going to enhance the chance of applying to a residency, to be successful in matching the residency, that will open the door more and more in hospital practice. So that's, in addition, when we ask people, where do you want to work? What is your preferred place of practice? The answer is, about 1/3 they said, I want to work in pharmacy, so about 100 people. And 1/3 of 100 people said, I want hospital pharmacy. So there is an aspiration, there is, people are really motivated to work in a hospital, but still there are those challenges that are preventing them from practicing in hospital. So this is just to present what was their first choice in terms of where the best practice they want to have. So the key takeaway message that I want you to get is, this is a lengthy process, and there are still a lot of hurdles on the way, but it is really still worth it. Changing the system is not an easy job. I can say that I have been an insider of the system for the last, 10 years, since I started my appointment with the college, and I was in the system for the 10 years before. So I have been about 20 years inside the system. Changing the system is not an easy. The example I always tell people, imagine yourself in a busy place and people are moving. You don't really have a lot of choice where to go. You might think, oh, probably we should go in this direction, but nothing really changed because it's a huge current that is going. It's not easy to change the system. Still, you can know how to work with the system, how to manage and navigate the system to get where you want to get. So those are the information that I was hoping to be beneficial for you. And I asked our people online, we probably have access to them from the other screen, to pose any questions as well as our attendees here. This is supposed to be a discussion, not a question and answer. Basically, people have their experiences, but as usual, I took over and so will not stop talking. So my apologies. Once I get the mic, I cannot stop talking. So please feel free to ask questions, provide your insight, as well as our people online. Please feel free if you have any message. Actually, there might be a message here. Here we go. If I click on this thing here. Perfect. People are giving thumbs up. Thank you so much. There are the other people here. Okay, please don't look it down. Okay. Okay. So please feel free to provide any insight, any question, or any comment. Please go ahead.
So, we appreciate. We wanted to ask what are the options that refugees and have the academic we can apply for in the past PhDs study. So if you can just give us some sample or example of what are the options for us and just newcomers
Perfect. So I'll repeat that question for our online people. What are the options for our IPG people to apply in the academic sphere? The answer is, if you are going to go to the alternative, other than having the license, you want to go to master PhD, you can apply to the research area where you are really interested in. That's if you want to take a thesis-based master's that requires courses plus a big project. For example, in our pharmacy school, we have thesis-based programs in pharmaceutical sciences. That's if you love to work in a lab, love to work with animals, chemistry, and so on. Or we have the practice, or what we call the dry lab. If you would like to work with data or analysis and stuff like this, that's what you apply. So that's the thesis-based masters. The alternative is course-based masters, something like Master of Public Health, for example, or Public Health Administration, or something of that sort. Those usually open the door for you in pharmacy administration or health administration jobs that are a little bit related to pharmacy, but it is not per se pharmacy. Some people take this and they are employed by the Ministry of Health, for example. They look at the administrative side, they work in those aspects as administrators. That is a course base. If you want to go to the thesis phase, that means you are really attracted to research. You take courses and then you do this project. That will give you the academic pathway. Now, not every master or PhD will end up working in university. They might go and work for industry, which I have a lot of graduates that they end up working for industry, or they might go to a government jobs. So I don't know exactly the percentage, but those are the three options that you can do. How to get to a thesis based, things are a little bit tricky here, because you have to show the supervisor that you have the skills that are required. So you have done a previous research project. You have published a paper in a good journal, not in a bad journal. And you have learned a research technique or something like this. So you have to show that, and you have to present yourself that you know exactly what this supervisor area of research is. The last thing you want to do is send an email that is a copy paste that is sent to 100 people. Some people send me an email saying, I really like to work in the animal, blah, blah, blah. So this person clearly did not know what I do. I never work with animals, and never work with cells and stuff like this. So they are copying and pasting for every faculty member. That's not good. Or if they are always look for research in pharmacotherapy, great, but be very specific and show and present your skills, your research skills that will convince the person, because this is a big investment. When you accept a master's student, not to mention a PhD student, this is a huge investment. So you have to be 100% sure about the student. I told you about my supervisor, he had to speak with 7 people to be convinced and reluctantly ask me for an interview, because that's totally true. It's a huge investment to invest in someone. So I hope that answered the question. Just looking to see if online people are posting anything. please ask any question or provide any comments. Yes, please. I'll give you the mic so people on the online they can hear.
Okay, thank you very much, Prof. That was very interesting experience that I got. Especially I feel that we are contributing evidence generation so that the gap with IPG versus the local professionals, I can understand that there is a mismatch. So having all these to fill the gap is very interesting to see. So with credential evaluation, I was thinking about for the evaluation of my back home credentials with the international assessment scales like WES. So is that helpful, or just I see that the PBA or the practice centers are evaluating directly? So I want to have a clear image on that. So thank you very much. That is my question.
Thank you so much. So the question is how to do the credential evaluation. Basically, the university transcripts and degree, how to get it evaluated. I'll tell you the answer from my own experience. I don't know how the system really is now. In my time, WES was not part of PEDC, so they did not accept. So we had to send the documents directly from the university to PEDC to do the evaluation. At that time, again, I'm talking 2004, 2005, mind you, 20 years ago. So at that time, WES was only used for people who want to go to university, for example, not PEDC. So I don't know how they are doing it right now. Do they accept WES now, or do they do their own thing? Perfect. So they don't do it through WES. Okay. So I'll repeat this for our online people. So PEDC asks for the documents to be sent directly to them, and they do the evaluation. Now, in my time, it was sent, or it was supposed to be sent from the institution itself. You cannot send it as an applicant, so the university should send it directly. I know a lot of universities don't do this, so I had to really struggle in my time. Ask the Massachusetts University, please do it. So they have to give me an envelope, close it and stamp it. It wasn't really that easy job at that time. Yes. Excellent. So that's a good information. They accept emails from the official email of that institution to give that information. That's good. So again, those are the complex regulatory issues. They change so much. So always work with one person who is up to the regulation at that time. I know there are a lot of frustrations over the time, over the road, but still, there is a way to get things through. In my time, I was with PEDC and the National Association of the United States, which they have their own thing. So it wasn't really also easy to manage both of them. So to answer the question, apparently WES is not really recognized or mandated by PEDC. Perfect. I hope that your university sends it directly, because that will save so much trouble. Yes, please. I'll give you the mic so our online folks can hear.
Thank you, Professor, for your insightful presentation and your interesting life, your life of the past. So, having said this, we just did an advice on how to proceed with our credentials. For instance, there are different processes like doing bachelor degree and master's. That some people could have also PhD, and then they might have also an interest to be engaged in universities. However, the equivalent license might not be, easy to get some type of job. And others could be like, students, PhD students, and they might want to be engaged as students at the university. In back home, they might have done PhD in the process, and then they came. So that's also another area. And the issue here is sometimes we feel like we have to get a license from another experience, even from the bachelor degree. So how do you see that? I mean, should a person take the lower level degree while there is another degree, or for the, I mean, which one is smooth from your experience for the lifetime, success? Thank you.
Thank you so much for that question. So I'll repeat to make sure that I understood correctly. So you have the two options, either to go through your licensing exam, depending on your background that you came from back home, or you can attend university here with whatever advanced degree. Correct? That's the question, the two roads. The answer is you have to make a choice. I do not advise to take both of them together, because the licensing takes a lot of time. You need really to focus on your study, as opposed if you want to take a program here, say a master, course-based master, that also needs full-time focus. So my advice is to take your choice. If your goal, the ultimate goal, is to be a licensed pharmacist, I think you should focus only on the licensing exams. If your goal is to go through academic advancements, master, PhD, that should be your main focus. I know people who took both of them together. That is very difficult and makes you do not be able to excel in any of them, because it is a huge time commitment, not to mention we have our own family, our own life, and so on and so forth. So my advice is to see what is your ultimate goal, where is your ultimate goal, and then make your choice. I know people who work in pharmaceutical industry. They really see themselves as pharmaceutical industry persons. So they went to a private institute here in Toronto. They took their courses and they work in pharmaceutical industry. That's what they are happy with. Not to the license, not to the master degree. That's their goal. So look at your final goal, where you want to be there, and focus on it. That's a process that takes about 2 years. It is not impossible, it's totally doable, but it needs focus, full-time, concentration to get to the goal, or to the final goal that you want to be. I hope that answers this question. Yes, please. I'll give you the mic.
Morning. I have a patient. I'm already started with studying pharmacy, so preparing for EE exam. With tips, I've just tried to contact them, and they told me that my university has to send my transcript to them. So I'm waiting. But meanwhile, I'm studying with pharmacists. I'm asking if I'm studying with pharmacists too, because pharmacists prepare the student for EE or SKIL and MSKU. So I'm asking if I'm studying with pharmacists, do I have also to do IPG?
Perfect, thank you so much. So just to be clear, PharmaChief is a private company that prepares students for the exam. Is this correct? It is not affiliated with the university. It is a private company that you pay a fee and get the preparation, correct? Okay, so to answer you, there are a lot of companies that do this preparation. They are not affiliated with the university. It is something that, like you pay for a tutor, for example, to somebody help you to prepare. Now, if you find that it is necessary for you and you are ready to invest the money in that, that's good. That's a decision that you make. But in terms of the IPG requirements, the college is very clear. You are only exempted from IPG if you pass your qualifying exam part 1 and 2 from the first time. This is the only time that you are exempted from IPG, which I don't really recommend. For me, IPG was a great thing. And if you are going to invest the money for me, my advice is to go to the IPG. I don't know if there is a wait list on it, or is it like you apply and you get in. I understand, but for IPG, is there a wait list, or you can? Okay, so in order to be part of the IPG, you have just to acquire the evaluating exam and go to the IPG. That's my recommendation. But still, if you decided to go with the other companies, that's totally fine. But note that the only time that college will exempt you, at least in Ontario, from IPG is if you pass the qualifying exam, but both parts from the first trial. Even the second trial, they don't allow this. Okay, so that's a decision that you have to make. I don't know how expensive those companies are. I know IPG is about what, 15,000 now? 18, so it's more expensive now. So 18,000 for almost 2 terms. It's 8 months or 7. So it is an investment. Again, in my time, it was about 10 or 15,000. I forgot the exact number. But for me, I felt that it is really, really worth it. Like, it's worth every penny that I paid. Again, I'm not affiliated with the UFT, so I'm not making a commercial for them. That's my only experience that I really found it is really helpful for me. But again, everyone's situation is different. They can make the decision to go to the private companies, that's by all means, but know that exemption only applies to passing in the first trial. Perfect, thank you. Perfect. It looks like we are now at the end of this session. I hope that it was beneficial and it was a good investment of your time. Thank you so much for attending.